Hello everyone, welcome to one of my new videos. Today we are going to meet someone very special and a renowned person who is a specialist in healthcare and physiotherapy world. So let's meet him in his clinic. Today this podcast is going to be very special for me because the personality we are going to meet is very great and has a lot of expertise in physiotherapy world. Let's see how it will go. Hello everyone, welcome to the Hardeep Show. So today we have guest Dr. GD Prathap, who is a specialist in healthcare and physiotherapy. Welcome, sir.
Thank you. Thanks for the introduction.
So let's start with your journey. How did you start physiotherapy and what was your passion about physiotherapy?
So basically, I am belongs to down south. I'm from Thoothukudi, which is near to Kanyakumari in Tamil Nadu. And yes, I was an athlete. My passion for sports brought me to the profession. And when I wanted to do something in healthcare professional, I left with the few options. One is becoming nurse, nursing into the nursing profession, or getting into the MBBS admission. And I was not so good at study, so I asked for the physiotherapy. And being coming from the state board, not from the CBUC, there was a lot of struggle. We had it in our college, but somehow I managed to complete my degree with a good score, of course, with plenty of clinical exposure. Then I went to do my masters in same city, Coimbatore, Tamil Nadu. Once I completed my master degree, then I was having a lot of interest in teaching. So it's good to begin as a teacher. When you want to learn more, it's always good to be in a profession, teaching profession. That actually give you the plenty of option to expose yourself into the clinicals, as well as research and academics together. So I came to Punjab in 2016, and with a lot of I was so skeptical about the place, new place. Everything is totally different from the south. Started teaching at the Lovely Professional University as a assistant professor for 3 years, almost 3 years, and even I won the a couple of awards, including best teaching awards 2017. If I'm not wrong, 2017 I won the award. And yes, our teachers were a little different from the teachers from the north. They were very strict. I also wanted to be like that. That's how we created some good students in the Loving Professional University. And then, of course, I met my wife. She's also in the same profession. Then we planned to marry. She's Punjabi, of course. Her name is Dr. Shiv Sharanjit Kaur. And we both wanted to go Canada as everybody wanted to go.
Every Punjabi also.
Yeah, yeah. In 2020, we had launched our file. Everything was okay, but suddenly the COVID has come. Then we had a plan B to start our PT physiotherapy practice because there was a need for some good physiotherapy, authentic physiotherapy practice in Toba region, especially in Fagwada, Zoria, Jalandhar region. There was some physios, and here the problem is the good physio they don't stay. The market was not so good that time. The awareness was not so good. So everybody goes to the orthopedician for the neck, back pain, whatever, and they are happy to take the pills. So, so we were not enjoying the kind of market where we can survive. So everybody have to go for Western countries if they are capable enough, and we had a same plan. But then, uh, as we started a small clinic for a temporary, we started a small clinic and we had a good support from the Fagoda community. And Fagoda is a small city, yet it's well connected with the people. And they love to have sessions with us because we were doing something different. We don't we do the proper diagnosis, proper assessment, and we were hardworking, and we encourage the movement, not kind of quackery. People in the name of freedom they give the drug medication. So we did the authentic physiotherapy in all the aspect. In my mind, in our mind, even if we have a small business, we need to run it in a very fine manner.
Sure.
There should not be any mistakes.
Sir, as you told, you were an average student in your school, but you proved that average student can be very successful in life.
Average student in the sense, the time which I had to utilize for the sports, playing with the friends, and studies. So if you are only the bookworm, or only if you focus on the studies, you may be extraordinary in the studies, but that don't guarantee the success. So you need to explore. Childhood is all about exploring the everything, having fun with your friends, and going to play outdoor games, and doing some sports and everything. I had a good. I come from the small village where I had a good option to play out. So our average is something, until my school I was average, but when I reached my university or college, I had to do the hard work, because somehow I need to get it succeed. To become a successful physio or successful person. There's no other option. You cannot be average. You need to think beyond average to become a successful one. So I was a very average guy, and also I was an extraordinary guy when I was doing my job or my college education.
Sir, what cultural difference you found between North India and South India?
South versus North, there are a lot. I start with the food. We eat light food, we eat a lot of dosa, idli, such a meal. It is very light. Here, people eat, they enjoy eating people here. They don't compromise the quality and quantity of food.
So what is physiotherapy? Because in India or we say Punjab, this the physiotherapy is not something that is very old. It's a new trend that is going in the Punjab or Indian states. So what is physiotherapy?
Physiotherapy in modern medicine, you can say the profession dedicated to your movements. Whatever disease or disorder that affects your movement, which literally, if you want to say, which stops you to move without pain or without restriction, we actually work on focused on the movement in our mind. You can say. So we uses the different things to achieve the better quality of movement. Number one, education of the patient, educating the patient for the better lifestyle. Most of the lifestyle issues compromise your movement quality. The next, we also do work with the some modalities, electrotherapy modalities. We have a wide variety of modalities, from the just lamp heat to we have a sophisticated instruments, robotic spine, decompression, or shockwave therapy, or shockwave therapy. There are so many modalities we have. And also the exercise and hands-on manual therapy. Hands-on manual therapy is like mobilizing the joint, releasing the muscle tension. So we use our hands to manipulate the tissues in order to get the less pain, improving range of motion, also improving the quality of movement.
So there's a lot of misconception about physiotherapy as we know. That people think it will do nothing, that painkillers are everything. They don't go for the physiotherapy first. Why there is a lot of misconception about physiotherapy?
Early days, physiotherapy was not having the direct access. Patient will be referred by the orthopedicians or any doctor. They themselves refer to the physiotherapist. In such a scenario, they try everything, like all the medications, all the self climbed exercise, everything they try. When it fails, last minute they send to the physiotherapist, which become very challenging for the physiotherapist to in that much after the time delay treating the some patient become incredibly difficult. That's why the worldwide as physiotherapists become a first-hand practitioner. Even if you go to the UK, US, everywhere it started becoming the first-hand practitioner, which means patients do have direct access to the physios, because physios also have equal education of other healthcare professionals. So in India now, recent updates, we have a 5 years degree, which is almost equal to the other medical professionals. So 5 years when you spend in the college, of course, you know how to diagnose the problem. The medical diagnosis is different. Physical therapy diagnosis is different. So for an example, if you have the frozen shoulder, your shoulder is frozen. Doctors say it's a frozen shoulder. For physios, we need to dig deeper. We will see, okay, what is the level of pain and what is the range of motion deficiency. We need to evaluate. We need to evaluate the dysfunctions and impairments. So we have the something called as physiotherapy diagnosis. So when the patient comes to us, we start taking the history and we physically examine the patient. If needed, we send the patient for the any conformity test. Then we measure the kind of impairments or deficit which they are having. Then we started working on that. So physiotherapy is something actually work on directly on the impairment deficit, which your medication don't do. So when people take medication, it may relax the muscle for a temporary, it may reduces the pain temporarily, but it don't uh, make the condition better, right? Like if someone's having the injury, the injury healing depends upon the quality of movement and also the precaution which he is having. So there are so many problem with the profession is, this profession title were not so protected in India. Even some massage people also say they are doing the physiotherapy. Some quacks are saying they are doing physiotherapy. So people in a root level they get confusion of who is actually a physio. What
Now
degree
people
they do.
take physiotherapy as a massage center.
Yes, yes, that's the biggest issue. So nowadays we always tell the people we are physiotherapists with the education. We are forced to tell the our community that um, we are actually physiotherapists because there are so many misconceptions around us. And also the other problem is that due to the Instagram, these all the things, people put the reels claiming themselves a chiropractors. You see now the quacks using the chiropractor as their title. Before they were using the physio. Because this physiotherapy profession become well secured now by the government law. So they can't use the physiotherapist title. Now the quacks started using the title called chiropractor. So in India, even I don't seen educated chiropractor because India doesn't have the chiropractor education yet. It is still non-regulated profession. So physios who trained in chiropractic adjustment, they are using that technique as the either complementary or adjacent to their physiotherapy techniques. But now every quacks they try, every people who even they do harsh manipulation they themselves call as the chiropractor. And the problem is someone having the chronic pain, it can be a cancer also. Okay, but physios be trained how to refer the patient immediately to the concerned physician. Okay, if the patient comes to me, if they have some hidden issues, it is not falls under the scope of my practice. I cannot delay the time. I will send the patient immediately to the specialist. Okay, because pain is the vague symptom. It is the hidden. It shows that something problem is hidden. Okay, it can be simple pain which comes under the physiotherapy, or it can be different disease. So quacks they delay the diagnosis, they give the fake promises, and also they make money and left with the danger or harm to the patients. So I guess the awareness on this side, especially northern zone, we still say lacking.
Lack of awareness.
Yeah, lack of awareness because they do not know who is actually a physio. They know that physiotherapy is good. Problem is finding the who is educated physio. That's the biggest challenge. And before we were not hardly get the referral from the orthopedicians or other doctors. Nowadays, the doctor itself have a good awareness that this problem better than medication. Physiotherapy will work much better. So I need to send to the physios.
So if I may ask, is physiotherapy costly?
Physiotherapy is most affordable treatment option, but you cannot compare with the daily medications. Okay, so you need to see to become physiotherapist, someone spend 5 years of their life to become a physiotherapist. Okay, so if you need to calculate in the way that like it's one of the least side effect you're gonna get, and it address your root causes. It's gonna make you stronger. So of course, in that aspect, physiotherapy is one of the most affordable treatment option, and also it prevent you from these surgeries. So definitely, physiotherapy is the affordable one, at least in Punjab. So you cannot compare the price between the Delhi to Punjab or Mumbai to Punjab. 7 times we charge lesser than the Mumbai. So same, I also have a clients in Mumbai. Whenever I go, I treat the personal patient there. I charge for visits 7 times higher than the what we charge here. So cities, based upon the awareness. I also wanted to invest so much money on the physiotherapy in Punjab as the awareness grow up. It's like if I put a lot of money, again I need to work with the patient. It's not like only machine works. We need to also work. It's a human effort is there. Your knowledge is there, and also the missionaries, which is very expensive nowadays. So from people buy from the daily cheaper missions also. Yeah. So many days have daily missions, but we have a high quality of missions because we don't want to pay free treatments. Patient hardly get to know is it actual mission or not. Okay, so I can spend 5,000 for the mission also, 5 lakhs for the mission also. We have here high quality of vision. So in that aspect, when we invested our knowledge, our time and mission, we try to keep the price competitive. We can't charge really high amount. Okay, and we believe in treating the maximum number of cases will make our drilling guidance really smooth. So I have to think at the end of the day, I need to think about the salaries and rent and the electricity. Punjab side is one of the highest electricity bills in India. Yes. As compared with the south, we have electricity bills to higher side. So and taxes, corporation taxes, so many expenses are there. So still, I can guarantee that we are having the most affordable fee than the rest of the India.
So what is the rivalry between a physiotherapist and a painkiller? Why they are against painkillers?
Yeah, because painkiller do not fix the problem, and painkillers are also the addictive one. I have some cases in past. They even got the kidney damage by consuming the regular painkiller. So in India, you do not need any prescription to buy painkillers from the medication shops. We do not have the good regulations yet. You go and ask you say the symptom, and your pharmacist is going to give you the painkiller. Like that, people consume their own without getting diagnosis. They consume the painkiller on regular basis. On the other side, pain is not the problem. Pain actually a symptom which tells you there is something wrong. If you just suppress the pain with the painkiller, you get the delayed diagnosis. So definitely your treatment option will be limited when you will be lying for a longer time.
So you want to say the painkiller doesn't eliminate the root of the disease, but
Yes.
physiotherapy will.
Yes. Physiotherapy, painkiller will not fix the problem first of all. It reduces the inflammation and pain temporarily. I don't guarantee you become stronger at it. Physiotherapy will guarantee you to get your fitness level up. If you have strong muscles and joints, your injuries heals faster and you will be healthy again. You will be walking better. You will be lifting weight better. That ensures your overall health will be. And also it affects your mood. If you have any deficit, any impairment, if you can't able to lift the weights when you go gym, you'll be depressed. So if the physio make you stronger, lifting the weight which you deserve again, you'll be happy again. So physio definitely directly indirectly helps a lot.
So let's have look for the clinic.
This is our consultation room where when the patient comes, we interview the patient to understand their all the aspect of the issue. Then we do the physical examination to evaluate their level of injury and severity of the problem. So also we do the counseling of the patient also about the treatment process.
Okay. Yeah. So what's the main reason for the back and neck pain for the office people? Like what is a good posture or bad posture when you sit on the chair?
So if you decide number one is sitting for a long time is the new smoking. right? It damages your entire body, including your cardiovascular system, your heart also. So the good posture is the next posture. You need to frequently keep moving. And if you decide to sit for a longer time, that means you need an intense exercise for 40 minutes a day, which ensure that you can sit comfortable. And also need to have some stretches and some strengthening exercise for your neck and your spinal muscles, which if you have, you really definitely love teaching that. Our disease prevention aspect, when the patient comes, we ask about their sitting habits. We ensure that patient, when we after the treatment, they do certain exercise which will make them capable enough to sit for a long time. Of course, we educate them to keep moving rather focusing only on the good posture.
So can you look more?
Yes, yes. This is our reception area, and we have a receptionist. She ensures that you reaching on time. When you reach, your appointment's already booked with your treatment table. Everything is ready along with the therapist.
So I can see your clinic is more like an aesthetic area, na?
Yeah.
How did you design it or someone you would like for you?
Me and my wife together we did this because we believe patients should not feel that they are going for a treatment. We should also give you the pleasure of being inside and clean and healthy ambience, which we believe that definitely helps the patient mentally to prepare for the treatment.
So I can see the paintings on these walls, and what these emphasizes on.
Basically, this is physiotherapy background. What we do uh, inside the clinic, that we shown here indirectly. And it was like more like a restaurant feel because it was restaurant before.
Okay.
So I want some kind of physiotherapy background here, and the patient feel like okay, it's balancing between the both the wide.
So can we have more look of your clinic?
Yes, definitely. These are our treatment options, which usually advanced treatment options.
Sir, I can see a lot of certificates and awards here. So what's it about?
Yeah, this is like whatever we qualified for.
Mhm.
And my master degree and my wife's degree, and also I'm certified in brain healing and spinal manipulation techniques, including chiropractic adjustment and kinesiotaping. And some other one more is the Mulligan. It's also again a manual therapy concept. So this is one of few which is important certification which I have done to enhance my clinical practice so that I have displayed to improve the trust of the patient.
So I can see in another room here.
Yes, this is the manual therapy room where
Okay.
we do the spinal mobilization, adjustment, and spinal manual therapy. It's a drop table. We try to adjust the spine, manipulating them
Okay.
with that. Okay. This also uses the gravity to adjust the spine with minimal force. And also we have shockwave. This is one of the latest advanced modalities in physiotherapy practice.
Mhm.
And any chronic injuries also need a recovery. Your body stop the recovery process in chronic injuries. So this stimulate that recovery process by triggering these small injuries inside the tissues.
Mhm.
So small injuries, again, your body think the injury need to be healed. So the old injuries also get healed very well.
How did it work?
It produces the shock waves, which is the high enhanced sounds which get inside the tissues, which breaks the tissue level. It produces the micro trauma, small damages, you can say, controlled damages, so that the blood flow will be rushing there to repair the process. And at the cellular level, there are so many mechanisms that involves to bring the good healing process.
So I can see you have given privacy to all your patients. You have created a different chambers for every patient.
Yes, we want, first of all, we need to give the privacy when the patient get it treated. That is our utmost care. And we also have the more female patients. They feel better when they are having the good, not only the curtain, but also the separate cabin. And also we have open coaches where we have the athletes or when they are male patients, they
Mhm.
can be comfortable with the curtain itself.
So are you a fan of Muhammad Ali?
Yeah, indeed, he's the great. Muhammad is the great, and I really wanted to give you some sporty background So when I was thinking, Muhammad Ali was the first to pick. Yes, he was the one was back to back such a win from the very small background, and he did a wonderful job with the boxing. So I kept his photos.
So what this machine is about?
So this is the advanced ultrasound sonic machine, which has the two head. One head produces the 1 megahertz, which has the better penetration range for the muscle or deeper areas to be covered. The another one is the 3 megahertz, which actually for skin issues or any scar, old scars, or if you want to get it treated, your superficial ligaments, uses the 3 megahertz.
I can see other machines also. Please tell us.
This is the laser. It's a combo machines, and also most of the part dedicated to the laser. The laser is something is a kind of visible light spectrum that actually increases the blood flow and collagen level, collagen synthesis, and it improves the healing process of your tissue. Also, it reduces the inflammation, which is very very helpful in sports injuries. And we have a tense and muscle stimulator, which to reduce the pain, acute pain, we use this to reduce. This is one of the things which actually replaces the regular painkiller. So it doesn't have any side effects when it is indicated. And we have a IFT. IFT is to relax the muscle to have the deeper pain relief. And we use the different modalities according to the patient symptoms and position.
So is it like tense or it's like more of ultrasound?
That is TENS.
Okay.
And this is IFT. IFT in the sense interferential currents. So we have Dr. Lovepreet is here, who is very dedicated, and he is mobilizing our client who is having suffering from the frozen shoulder, and is very delicate and gentle manual therapy movement, which to reduce the pain as well as to improve the range of motion of the patient. So this is hands-on manual therapy. So we don't just give the machines; we also teach the exercise. We perform the manual therapy, which is very good at this level.
And it's a matter of hard work.
Yeah. We need to put the effort. Is physiotherapist in the sense not only working with the, I mean, now working with the skills in the hands. Also, you need to spend your knowledge.
So we have one client here who wants to give a review for Dr. GD. So let's ask her.
I think Dr. GD is amazing. I came here in great pain, and in just a few weeks, much of the pain is relieved. I feel so happy coming here. The ambience is so good. They look after us very well. And I really recommend others also, those who are suffering from injuries or any kind of muscle pain or other physical ailment. So this is a good place, and you just feel at home here. I'm very happy coming here.
So what do you want to tell those patients if they have a pain, very less than pain, or what they should do after getting the pain before coming to you if they want to do something?
So self-management for the patient when they do not know how severe the problem is to limit the activities. Okay. So if you met the physiotherapist already, he will recommend what level of activity you can do. The now recent evidence says complete rest should not be done. But when the patient do not have a good, proper diagnosis of their own problem, it's best to give the enough rest. We don't want any re-injury. The next things to do is if it's acute injury, which means just enough injury happened, give the ice. Though we have recent evidence for athletes, we don't recommend the ice, but normal people, it's good to take the ice massage or ice application. Just press the ice, put it in the polythene or any waterproof bag and apply with the mild compression for 5 minutes, not more than that.
Okay.
You need to somewhere around 5 to 10 minutes must sufficient. And if the pain is old pain, more than a week, couple of weeks, then the heat packs can be helpful. Make sure you're not getting wide with the hot water.
Sir, I always keep a rapid fire round in my podcast. So let's start. So what is the one myth about physiotherapy?
It's costly.
Costly. Okay, sir. So if you want to choose yoga or gym?
Gym.
So can I ask why?
The gym covers every aspect of the training. Yoga, meanwhile, covers in my knowledge, it covers the like to moderate exercise, good for relaxation, good for uh, giving your recovery, improve the recovery, mobility. But gym, you can do multiple different type of exercise. In my opinion, I like doing gym.
Sir, ice or heat for pain?
Uh, Depends upon the stages of injury,
Okay.
as we discussing earlier.
So one exercise everyone should do.
Running,
Sir, one health habit everyone should stop immediately.
overeating.
Overeating. Sir, does it have any impact on muscle pain or any other thing?
Everything starts from the eating habit. Eating largely affect your how you move, how you live, how you think. So eating need to be really careful.
Hmm. So what's the one health advice or message for the patients and the office youth or upcoming youth? So what's message you for them all?
Wake up early, start your day very early, plan everything clear.
Hmm. So if anyone want to pursue a career in physiotherapy, so what's advice for them?
So if you choose to become a physio, you also choose to serve the people, serve the humanity, and you need to be very ethical in your practice.
Hmm.
For a long run, no fake promises. So be ready. This is not a profession for lazy people. So your fitness matters a lot in our profession. When you talk about the fitness to your clients, they look at you. So if you're not in the good shape, definitely you cannot be a good physio. So to become a good physio, not knowledge or college knowledge, what you study from the college is not only sufficient. You also need to take care of your body and mind.
So if anyone wants to come to you and consult to you, how they can meet you?
Just you can Google Dr. GD Physiotherapy, Pagwada or Jalandhar. You get our reception number. Just call and meet us.
Thank you, sir. Thank you, sir, for the podcast. Thank you, sir.
Thank you so much.